All right, go ahead, Joyful. Thank you.
Well, my name is Joyful Stoves. I am a program specialist with the Division of Developmental Disabilities, and I will be speaking to you today about the services that we offer, including eligibility and funding for services. We also have a variety of information on our website, and as I go through the presentation today, I'll reference some of the available documents we have. And a lot of our documents are also available in Spanish if you have Spanish-speaking families that you work with. So first, the governor wants me to tell you about his vision. You're all state employees, so you're well aware. But we do want to say that the Division of Developmental Disabilities, we've really tried to increase our efficiency and effectiveness. We're also trying to be a lot more transparent and reach out to those in the community. So I've been doing this presentation in a lot of schools, reaching out to a lot of parents and advocacy groups.
Not to interrupt, we still have people on the conference line that aren't muted. If everyone can please mute your phones because we can hear some people talking, that would be great. Thank you.
This next screen is a list of our acronyms. So this might be a good piece for you guys to print if you work with us a decent amount. DD is going to refer to anything that's developmental disabilities or to our division. We'll see HCBS in reference to our waivers. All of our funding is matched through Medicaid, so we have home and community-based services. IBA refers to the amount of money a person in our services has. The ICAP is our inventory for client and agency planning, and this is a tool we use to assess. When we have team meetings and we come up with our plans, they're called ISPs, or individual support plans. When we make decisions, we have notice of decisions through InFocus. We do the objective assessment process, and that includes the ICAP. It's just a larger process. When we refer to an SC, it's a service coordinator, and that's our case management. And then VR refers to vocational rehabilitation. Usually Nebraska VR is doing that. So a little bit about our division. Obviously, we're part of DHHS. We are responsible for developmental disability services in Nebraska. We currently have over 4,000 people receiving services in the community, so those home and community-based services are the largest part of what we do. We do also have state-operated services down in Beatrice, and we have about 100 people who receive services in a campus down there. So for the home and community-based services, that's the bulk of what we do, and that's what I'll be focused on today. We first determine eligibility, and then we provide funding and oversight of the services. So we are responsible for serving as many eligible persons as possible, while ensuring that people we do serve are healthy and safe. And the way we do this is by providing that the HCBS, home and community-based service waiver through Medicaid. Doing the Medicaid waivers allows the state of Nebraska to receive a federal match for every dollar we spent, and it's basically a dollar for dollar match. So we can serve a lot more people when the federal government pays half of our cost of services. Some people, families especially, they don't like the term waiver, and the waiver just means that a person is choosing to receive services in the community instead of in an institution, such as Beatrice. One of the documents we have online is a two-sided document called What Do I Need to Know About Medicaid? And it's just a really quick snippet. Obviously, I'm not from the Division of Medicaid, so we just put together a very brief information for families and possible applicants to let them know the general information about Medicaid. We also, also on this slide, you'll see that we do need people to apply for Medicaid benefits, and that's why we provide that information. People also need to use any other benefits, such as the Department of Education and Voc Rehab. So you'll hear a lot of people talk about how our services start at 21 years of age, and that's not necessarily true. We do serve children for residential, but we cannot provide any day services until someone is 21 because the Department of Education is responsible to that point. And then we also, again, work with Nebraska VR. Towards the end of the presentation, I'll have several slides specifically about Nebraska VR and how we partner with them. So a lot of people get confused about what DD services are. So first of all, what they are not. We are not Social Security benefits. Sometimes we'll hear families say, yes, I've applied for your services, I get a check. We don't send any checks to anyone. So if someone is getting a disability check, that's through SSI. We are not Medicaid, though we do require people apply for Medicaid. We are not financial assistance. Again, we don't hand out money. We don't necessarily step in a crisis. That is not the intent of our services. We are not behavioral health. We do not provide daycare, and that is a big difference between us and the aged and disabled waiver, is that we do not provide daycare services. We are not the aged and disabled waiver. The aged and disabled waiver is through Medicaid, and it's primarily focused on people with nursing facility level of care, whereas our services are looking at that ICFMR or the institutional level of care. We're also not housing assistance. We don't pay room and board or any of those housing benefits. On this slide, when I do presentations to schools and parents, it's very important for people to realize that while we're not these things, they also need to apply for those things. We all kind of work together. So at 18 years old, people should be applying for Social Security. And then at 19, if someone doesn't already have Medicaid, they should apply at 19 because they're now a household of one and their parents' income no longer counts. So now I've told you a lot about what we're not. Let's talk about what we are. We provide person-centered services. We want people to live in the most independent way they possibly can. So we focus on what a person wants and needs, what's important to them, and then also what they really need, what the things that will keep them safe, the things that will help them grow. Most of our services teach skills. So we do assessments and we determine what a person needs to learn to increase that independence. We really want to support what's meaningful to a person. So each person's services are going to look totally different based on what they need. And I'll get into that more on the next page or the next slide. And all of our services are voluntary. People are used to the educational system where it's an entitlement. With DD services, someone can step out at any point and just be done if they choose. So I mentioned that we teach people. We use the term habilitation, and a lot of people are familiar with the term rehabilitation, the relearning of a skill that you already had once upon a time. Habilitation is just learning that skill for the first time. So habilitation is just a service that teaches. Teaching can be cognitive skills, it can be social skills, it can be motor skills. We believe that all people are capable of learning. So again, we tailor the services to the person. One person might be learning to use public transportation to get them to a job. Another person might be learning to pick up a spoon. So it really is a wide range of skills that can be taught. Our habilitation services are kind of split into day services and residential services. Day services focus on employment. And for some people, that can be the basic skills that will eventually lead to a job. It might be the taking the shower in the morning, because that's something you got to do to get out and get a job. It might be basic handwriting. It might be super basic things, brushing hair, but things that are going to eventually get you to a job. For other people, it might be full-on job coaching. They have a job in the community, and they just need a little bit of assistance to maintain it. And then we have residential services. So again, residential services are teaching the skills and independence. It's important to know that residential services can be provided anywhere a person lives. Parents sometimes get scared that I don't want residential services because I don't want my son or daughter to move. I don't want them to go to a group home. I don't want them to just go somewhere. I want them in my home still. Residential services can be provided in a family home. It can also be provided in a person's own apartment if they live on their own. A person can choose to live with whomever they want, peers with disabilities or not, and we can provide services in that home. And then there are also some provider-operated homes. So that's kind of more the group home that parents think of. Those are options that are out there. We also do have respite. We have homemaker, we have transportation. So there are some other services besides the day and the residential. And I, again, want to point out residential can happen at any age. It's not limited to 21 and above. So if someone has a developmental disability, applying early, getting residential services as early as they can is always in your best interest. One of the booklets on our website is called Ready, Set, Go, and it outlines all of our services. We also have a quick guide that lists each of our services and definitions, just a simple one paragraph per service. So, if you think you need the services, you think someone on your caseload, yeah, they probably could use some of this benefits. How do they get it? The first thing is we need to determine that someone is eligible for our services. So to be eligible for our services, someone needs to be a citizen or a legal resident of the U.S. Legal resident means they've been in the U.S. for 1 year and have a green card. They also must be a legal resident of the state of Nebraska, and they have to have a developmental disability. The developmental disability is defined in state statute, so you'll actually find that that's different in different states. If you're working with someone who has moved to Nebraska from a different state, they may have been determined eligible in that state because that state may have a different definition of what developmental disability is. So just because someone received services in another state doesn't necessarily mean they're going to be able to get them here. The same is true in reverse. If someone's getting our services and they move, they may not be able to get services in that state, which is a little limiting for people, but that's how it works. So developmental disability is diagnosed by a licensed psychologist, or it can be diagnosed by a medical doctor. A medical doctor would be diagnosing those medical cerebral palsy, spina bifida, some of those genetic that usually have the developmental disability tied to them. There also needs to be a substantial limitation in 3 areas. It's conceptual skills, social skills, and practical skills. And a couple of things on our website, brochures you can look at. One of the, probably the key one for this, we have a brochure titled DD Services Eligibility. And that will list out the state statute in its entirety. And then it also has information specific to how we determine it. So that's a good handout to give parents or to give people. One thing you will, that is important that's not necessarily on the slide, part of the state statute is that a developmental disability has to be manifest before age 22. Age 22 is the cutoff for the developmental period. So most of the people you're working with are probably going to be under the age 22. It's not going to be a big deal to you. But we do find that sometimes if someone applies for our services and they're 24, not only do they have to show that they have the disability, they have to show that it started before they turn 22. So always better to apply early. When we do find a person eligible at a very young age, we redetermine eligibility at age 9 and we redetermine eligibility at age 18. I don't say that to say, hold off until those ages. Certainly apply earlier. But sometimes someone may look like they're going to have a lifelong disability, and by the age of 9, they've caught up with their peers, or by the age of 18, they've caught up to their peers. So we do just relook at those times. Also, another note on the diagnosis. A licensed psychologist and a medical doctor can diagnose. Psychiatrists are not able to diagnose. So a psychiatrist may prescribe medication for something, but they're not actually diagnosing that. And also, most school psychologists cannot diagnose. The school psychologist will know if they're licensed or not, but most people who work in schools are not licensed. So to actually apply for DD services, we prefer that people do it through Access Nebraska. And we just encourage people, if you think someone is eligible, apply. If you're working with someone and you think that they can be eligible for our services, apply. The application needs to be made by someone who is a guardian or acting in a legal manner. And I know that people in the CFS services, sometimes you guys are able to act in that legal manner and apply. So apply. Through Access Nebraska, the first time you go on, you will create a username and a password. I don't know how familiar you all are with it, but we do on our website have a document called Applying for DD Services. All the documents I'm referencing, if you go to at the last, towards the end, I'll show you a screenshot of our homepage, but we have a whole section just for eligibility. So all these documents will be throughout the eligibility, and then we also have a resources page that has literally every document, every resource we have out there. But the resource that's good here is it's called Applying for DD Services, and the document is literally screenshots of the entire application process. So we like to hand it to parents, to guardians, so they can go through and see that information ahead of time and know exactly what's going to be asked of them. If you do not complete it all in one sitting, that's fine, because you've made that password. It is secure. No one else is going to see that information, and it's not going to come to us until someone hits send. So you do have some leeway there. So once we get an application, and it may come through Access Nebraska, we also do have some people who fax it to us, who send it in the mail. However it is that it comes to us, within 2 days of us receiving the application, we will call the person who submitted it. And we will say, hey, we got this application. We want to make sure you need to apply for DD services. And we want to make sure that you gave us all the correct information for who to contact. Part of our application is consent to release information. So we are going to reach out to schools, to doctors, whomever the person said, contact this person. So for schools, we're going to request all MDTs and the most recent IEP. So for IEPs, we're looking at the current needs. That IEP can show us if they have those 3 areas with the limitations. And then for MDTs, we can't use an MDT as a diagnosis because it's not coming from that diagnosing person, but we can use it for things like IQ. It can show us that past history of what's been there, and it can show us that if someone has the past history shown through the MDTs of needing assistance, that they're probably going to continue to need assistance throughout their life. So it does help out to get all of those. And of course, we contact doctors and we get the diagnosis through doctors. Once we receive information, once the person reaches out and has gotten all that information from schools and doctors, we give 30 days for doctors and schools to get us the information we request. And then at the end of 30 days, we determine eligibility based on what we've received. If we receive everything we've asked for in 5 days, in 10 days, we determine the eligibility at that point. But otherwise, we leave it open for 30 days. If a doctor hasn't sent us something in 30 days, they're probably not going to send it to us. So that's the point we've cut off and make a determination. Once a determination is made, we send a written notice of decision to the person who applied. And it will explain that the applicant is either eligible or not eligible. If the person is not eligible, there will be a reason given. So the reason may be something like they don't have a developmental disability, there's no diagnosis. It might be something like we didn't see a deficiency in one of the areas. So based on that, someone can appeal the decision. If they say, well, it says I don't have a developmental disability, but I have this diagnosis, maybe we didn't have the diagnosis when the decision was made. The notice of decision will include information on appeals, and appeals can be done if needed. When someone is found eligible, we also contact them with a call in addition to that letter saying they're eligible, and we start the conversation about what kind of services are wanted. The applicant can receive service coordination right away. If the person has Medicaid, service coordination is available at no cost. If they do not have Medicaid, they would be assigned an ability to pay. So most people choose not to at that point. However, it is available. Also, if someone is on the aged and disabled waiver, they have a service coordinator through that program, and we can't have two case managers billing Medicaid. So we can't assign a service coordinator if they already have a case manager through the A&D waiver. We do have some people, especially children, who, if they qualify for both, will choose to have the A&D waiver while they're a child because child care is paid for through that waiver. But the A&D waiver focuses more on doing things for someone, whereas we focus more on teaching. The A&D waiver doesn't really have the employment piece, so a lot of times someone on the A&D waiver will look to transfer to our waiver if they're eligible around that turning 21. If someone is transitioning between the two waivers, we can have service coordination or case management assigned for both waivers for up to 6 months, and that allows for a smooth transition. We just can't have them on two waivers at the same time. So the day the A&D waiver ends would be the next day we would start. Or the reverse would also be true. Another reason some people choose the A&D waiver if they're qualified is that there is no waiting list for that waiver. So you can get on that a lot quicker. Most likely, when you are told that you are eligible for our services, we probably will not have funding for you. We do have a waiting list, and I will talk about that here in a little bit. So also when someone is eligible, we determine level of care right away, and that's just making sure that not only are they eligible with a developmental disability, but they meet those requirements to be on the Medicaid waiver. Because again, that Medicaid waiver gives us a lot of money, so it helps us serve more people. If someone is eligible for our services and not the waiver, it takes a lot more money to fund them for the state dollars. So the level of care refers to that ICF level of care, which is the institutional level of care. Most people in our services have no problem meeting that level. And the second step then is once there's actually funding available, then we go through our objective assessment process, and that's what actually determines a budget for someone. And we use the terms OAP and ICAP a little bit interchangeably. The OAP refers to the process, the ICAP is the actual assessment we use. But that won't happen until someone is actually offered funding. So the registry and wait list. There's always lots of questions about that. All money that pays for DD services has to be appropriated through the Nebraska legislature. Therefore, all eligible persons, we just don't have enough money to serve them. We have two lists for people who are eligible. The first list is the registry. Everybody who's applied for services, and we've determined yes, they're eligible, goes on the registry if we don't immediately have the money for them. Once they're on the registry, they're on there by their date of need. So when they get that phone call saying they're eligible, their guardian is going to tell us, well, we need services in 2 years. Put that as our date of need. Or we need services today. Put that as our date of need. Whatever date of need, that's the date listed for the registry. the date of need cannot be earlier than the date of application. So you can't apply and then say, well, I needed services 5 years ago. The date of need, the earliest it can be is the date of application. And then all those people on the registry, again, at ages 9 and 18, will relook at them and just say, yes, you still meet the requirements, you stay on the registry. The second list is the rate list. And the rate list is anyone who is still waiting for services and they've moved past that date of need. So if we give you that call and you say, well, my date of need is the date of application, I need services now, you move straight to the rate list if you meet the other requirements of the rate list. To be on the rate list, you do need to have Medicaid, because that would allow you to enter services right away, or be a child. A child can be on the rate list without Medicaid, because if we offer a waiver slot to them, they will get on Medicaid. And that's the same way with the A&D waiver. If we offer you services through a Medicaid waiver, you automatically get Medicaid because you become a household of one. And for people on the rate list, we expect that if we offer you services, you're going to say yes. We are currently redoing some of our regulations, some of our waivers with Medicaid right now. I think our regulations, our 403 regulations are currently with the governor's office. Once those become effective, if someone on the rate list says, no, I don't want services, they have to start with square one with reapplying. Because we really want this list to be people who are truly waiting for services. And if you're going to tell us, no, I don't want them, then you're not really waiting. So today, if you're on the rate list and you tell us no, the next time we get money, you're the first person we come to again. But that will be changing. The rate list is organized by date of application. So you move to the rate list based on when you say you need services. But once you're on the rate list, it's by date of application. So another reason to apply early. We offer, I'll get to kind of the order in which we offer next. But you want your date on the rate list to be as early as possible. So it's great for children to apply early. Again, if you're working with someone, apply early. As soon as you see that there's a diagnosis, apply. Currently, we have about 1,600 people, I believe, on the rate list. And we have taken off, I believe, 400 this year, but we've also added a lot because we keep asking people to apply. So there'll always be a list, unless the legislature decides we need a whole lot more money. So how do people come off the rate list? How do we offer funding? Funding is another thing that is in state statute. We can offer funding only through priorities. So this slide's kind of small. Again, I'll refer you to our website. We have a brochure called DD Services, Funding to Transition from Educational Services. The main point of that brochure is to talk to those people who are getting out of the school system at age 21. But it also has a section where it just lists, here's all the state statutes. And it talks about what the rate list is and what the registry is. So it is kind of a broad overview of funding, even though it then gets specific to those graduates. So our first priority is people in crisis. And this is sometimes where we find ourselves working with you all. If someone is going to be homeless, if there's an abuse and neglect risk, if safety is for some reason there's threats to life, to safety of the person, caregiver death would pretty immediately get someone the first priority. So if someone has one of these things happen, they're on our rate list, and they let us know, hey, my caregiver died. A worker lets us know, hey, their caregiver died. Now they need your services. First priority, we immediately have funding for them. The second priority is people who've lived in an institutional setting for 12 months. Per Medicaid, an institutional setting would be someplace like Beatrice, but it also would apply to nursing facilities. So if someone has been living in a nursing facility for more than 12 months and they qualify for our services, we can bring them out into the community. The third priority is the words of the state. And this is another area where we will work with you guys quite a bit. If someone is aging out of the system and they no longer have that support that they had under foster care or under probation, we can step in and provide the DD services to assist them. The fourth priority is the people coming out of the educational system. The fourth priority is the one priority where it's for day only. All the other priorities are for residential as well as day. And then the fifth priority on this is the wait list, the date of application. So this is when legislature says, here's some money, and we take the next 400 names off the top of the list and start calling people. So that's the fifth priority. Legislature did approve another priority this last legislative session. So our wait list is actually going to become the sixth priority. And our new fifth priority, once the law takes effect, is going to be for active military. So if someone moves to Offutt and they have a son or a daughter that qualifies for our services, they will now be the fifth priority. Our priorities in statute line up with the reserve populations in waivers. So again, this just kind of shows that we have the emergency is the first, the transition from foster care, you get the day and the residential, transition from institutional day and residential, the court custody, and the people from other waivers. So people who are moving from the A&D waiver would move on to our comprehensive waiver. Or a day waiver. Again, really the only time you're going to see someone come into the day waiver only is those people transitioning from the school system. Most people who are entering our services under emergency probably have the need for the residential as well. They have the option for day, but most likely we're going to see them come in under the residential. Each of these categories, we technically have to tell Medicaid how many people can enter under each one, and we're constantly just reevaluating, do we have enough slots, can we serve everybody, and I think in the past we have worked a lot with you guys for do we have enough people for people coming out of foster care and for people who may have emergencies that are working with maybe CFS in some manner. So once someone comes to our services, if you've gotten someone to apply, if they were able to enter under some sort of priority, what happens next for them? This is when we come in and do the OAP, which is our objective assessment. We're going to discuss with the person what their services are. We are going to determine how much money they have to spend based on that assessment. Someone who's learning to use the bus system probably doesn't need as much funding as that person who needs to even learn to use a spoon. So our funding should be based on how much assistance and how much learning the person is going to need. But the service coordinator is really going to be able to sit down with that quick guide of services or the more extensive service directory we have. There's 3 pages per service in the service directory. It's huge. It'll tell you everything you need to know about our services. The service coordinator is going to help the person decide how much money do I have, how much do services cost, and what services do I need. Once the person gets an idea of that, the service coordinator will help them find providers. We have agency providers, and we also have independent providers. Agency providers are going to be your organizations that are certified with public health. There are, I believe, 50 or 60 agency providers throughout the state. Lincoln and Omaha certainly have the highest concentration. Once you get into smaller rural Nebraska, a lot of times you'll find that there's one provider. So we also do have independent providers. An independent provider is passes, they're certified with Medicaid. Not sure certified, I guess they're licensed with Medicaid. They're a licensed Medicaid provider. But it might be a family member of the participant. It might be their aunt, their uncle, as long as the person isn't legally responsible for them. So it can't be a guardian, it can't be a spouse. We do have families that can provide services. So that's what we find. Independent providers are really good options for people who either are in rural Nebraska and there's not an agency provider, or they just don't like the agency provider for some reason. We also find that independent providers work great for people who speak sign, for people who don't speak English in their home as their main language, because they may know some people that can provide that service and speak their native language. But the service coordinator, again, will help with all the providers. If someone chooses an agency provider, the service coordinator will set up meetings, kind of coordinate getting to know them. If there needs to be tours of locations, they can do that. If the person chooses an independent provider and says, you know, I want my Aunt Sue to provide services, the service coordinator will help Aunt Sue fill out the information for Medicaid and get set up to be a provider. So I have just a couple things to say about Voc Rehab before I wrap up. We expect everyone between the ages of 18 and 65 to at least make contact with Nebraska VR. Their services really focus on employment. We used to do a little more employment than we do now. We certainly still do follow-up with people who have jobs. We can do some job coaching. But Nebraska VR and then the Nebraska Commission for the Blind and Vision Impaired, employment is all they do. So it's their focus. So they're the experts. They take the lead on it. VR for someone might just assess them and decide, yeah, they're not ready for employment right now. They can do some minimum wage. They can work in a workshop. If VR does that, then they step out and DD Services covers all of the daytime activities. Again, the service coordinator really will work with the person and help them understand when Nebraska VR would do something or when we do. Most, and I would say all, I think there's one DD provider that is not also a Voc Rehab provider. So most times, if someone in our services is working with their provider, they may not even know if the funding for their provider is coming from DD or coming from Nebraska VR. Hopefully we're working behind the scenes so that they just see that their needs are being met and they have the one provider. There is some limitation on DD services. If someone says, no, I don't want to work with VR at all, then that kind of limits what we can provide. We're not going to provide supported employment to someone who says they're not going to work with VR because that's telling us that they don't want employment. So they do have to use that service before we step in. So this is a screenshot of our website. I don't know if you can see the cursor on your side, but if you see the icons across the top of our page, not the icons on the very top. So the participants icon, if you click on that, everything is for the active participant or the applicant. There'll be a home page. Once you click on that, there's like a blue column on the left-hand side that's all the pages for participants. So there's a page specific to eligibility. There's a page specific to the transition at 21 years of age. There's a page specific to what are our services, what's our service array. So that's a good place to lead families or to go yourself if you're looking for information about services. We have information for providers, probably not the most useful page for you all. The resources is where every document we have is going to be found. If you want to find a brochure, it's all on the resources page. They are scattered throughout other pages where they're applicable, but we've put everything on the resources page, so it's just a one-stop place for people. The training page, specifically or usually providers use it, but anybody can use it. We do have trainings for people in services, and all of our trainings that are linked through that page can be accessed by anyone. You don't have to be tied to developmental disabilities to use them. The Our Future page talks about any initiatives we're doing, any rewrites we're doing to regulations, to waivers, anything we're changing and trying to improve for the future, you'll find there. And then the regulations and waivers is kind of the fine prints page. It links you to all our regulations. It links you to PDFs of the waivers, any of that fine print stuff, the technical. So really, we put the participants page first. It's probably the most useful and used by the most people. I guess backing up to our website. Again, this is a screenshot, so it's not really interactive for me, but if you are on our homepage and you scroll down, there's a public calendar. So anything we're doing that's open to the public is on there. Right now there's a lot going on in June because Medicaid has their state transition plan, public hearings, so those are all on our calendar because they affect our services. We also have a stakeholder meeting that happens every 2 or 3 months where the director of each of our divisions speaks. So you not only hear about developmental disabilities, but the director of Medicaid speaks, the director of Children and Family Services speaks, the director of Behavioral Health. Everyone kind of gives a rundown of what's going on in all the divisions. So that's here in Lincoln. There's also call-in numbers, but that's available to anybody. So anything open to the public is on that calendar. And then we have contact information on the screen. Again, if you scroll down below Courtney's picture, there's also some different contact lists that you can access through our webpage. So I guess if you want to go and see if there were questions typed in while I was speaking.
I sure will, and I'm going to stop the recording quick before we do questions. Thank you so much. I was taking notes like crazy. That was very